It's a power privilege to be on day 2. And I'm very glad to see this audience on a Sunday morning starting at 9 o'clock. I had a doubt whether I and the speaker will be the only persons here. But I'm very happy to see so much people here, and the people will be filling in shortly. It's a power privilege to welcome Dr. Arun B Nair. Arun B Nair needs no introduction to the people of Kerala and maybe throughout the world, because he is a Nitya presence in our TV channels and is the most sought after speaker on stress issues. As we know, we are going through very, very stressful times, and doctors are under tremendous pressure. Not only doctors but nurses too. And so this talk on stress will be a starting point on a series of talks that we plan with QPMPA on how we can prevent even suicides among doctors, because we have seen so many cases of doctors committing suicide, medical students committing suicides, doctors fearing about attacks. So let us listen to a renowned leader, a renowned speaker, and one of the most sought after persons to address us, Dr. Arun B Nair, my dear friend and a close associate of QPMB. Warm welcome to Arun B Nair. Thank you, sir.
Thank you, Devin, sir, for those very kind introductory words, and I consider it as a great privilege and honor to address this audience on a Sunday morning. So, as it has been very rightly pointed out, IMA had come out with a study recently about the longevity or lifespan of doctors, which seems to be around more than 10 years less than the lifespan of the patients they treat. So probably it is obvious that stress is eating up the medical profession, the medical community. So just brief introduction regarding stress among doctors, what can be done and what are the solutions forward. Essentially, the life of a doctor or the stages of the career of a doctor falls into 6 different phases. It starts much before the person enters the medical profession. Maybe the extremely competitive environment, the extremely toxic environment of being a medical seat aspirant, maybe spending 2 years during the higher secondary days, and sometimes even after that moving to certain coaching centers which are dedicated centers which train people for medical seats. And after that extremely competitive life is over, they get into a medical college and they think that life is going to be hunky-dory, but it is far from the truth. The next 5.5 years is going to be really, really difficult phase, especially during the first year and the last year. And once the person has graduated successfully in medicine, many people think that it is a very happy phase again, but not, because the relatives will be asking each and every doctor regarding the specialization you are going to get into. After the results of every postgraduate entrance examination surfaces, they will be asking the question, and there is this terminology like MBBS Gusti, and then they get into a postgraduate course of their choice after maybe so many years of effort. And it is considered largely all over India that postgraduate training or residency is a glorified slavery. And there are a lot of stories about stress among postgraduate residents, which I'm not going to the details. And after maybe 3 years, they become a specialist. If you want to become a super specialist, again, you have to go through the ordeal of an entrance exam and study for another 3 years. And maybe by the time you are in the mid-30s, if you are lucky enough, you may become a super specialist. And then where is an opening for a super specialist in a city? That's a big question. Around 3-4 years ago, my good friend, my MBBS batchmate, who had completed his DM in cardiology, asked my assistants to get a placement in one of the big cities in Kerala. I was inquiring with so many hospitals in Trivandrum, in Kochi, in Calicut, even in Kollam, but there was no opening available anywhere. And finally, he had to settle to a much less, lucrative place around Pathanamthitta district. That is the reality. And after that, once you become a consultant again, the tremendous pressure to build patience, to grow as a person in your specialty becomes a big problem. And maybe what happens in the life of a doctor after you become a successful consultant. There are a lot of people who are extremely successful as consultants doing great work, But of course, after a few years, a sense of boredom creeps in. And probably this phase, the last phase, the sense of boredom, that is going to affect the life of a doctor very much. So what we plan to discuss here mainly is something called boredom in the life of a doctor, and boredom leading to a whole lot of issues. And one major issue which happens is burnout. What is meant by burnout? Burnout is a stage in which you work and work and work and reach a certain stage in your life that you decide you don't want to proceed anymore. You feel angry, you are depressed, you have concentration problems, you avoid work, you avoid going to the hospital, you are late to work, and you are psychologically absent. What is meant by psychological absenteeism? You are physically present in front of the patient, but your mind is wandering somewhere else. The patient may be asking you very pertinent questions, very anxious about his health, but your mind is wandering elsewhere and you are unable to satisfy the patient. You feel tired, lethargic, your sleep is deprived at night and you feel sleepy during the daytime. There is an alteration of the circadian rhythm. And self-medication is what many doctors resort to at this stage to overcome burnout. Maybe alcohol, drugs. In years, there used to be stories of doctors who used to get addicted to opioid medications which were used for pain management like Fortrin or Pethidine. Nowadays, even more variety of drugs are available. And behavioral addictions is another very important self-management strategy which many doctors use. They indulge in the screen. They spend a lot of time in screen, more commonly seen in female doctors than male doctors. So how to manage burnout? You have to take care of yourself. You need sufficient rest and exercise. Learn to say no. Imagine a situation where you are going for a marriage function or a reception at 8 p.m. and somebody is coming in demanding your attention. It is not an emergency, but since they could afford only this time because of their work pressure, they are coming to you. Should you entertain them? It's a big question. Maybe during the initial phase of your career, you entertain every patient who comes your way because you think it is important to build and grow your career. But after a certain stage, you should set limits and become assertive. You should fix your time of consultation, and after that, you should try to be yourself. Learn to say no whenever necessary. Fulfilling extra professional life. Many of you may be having a lot of hobbies. You may be singing, painting, dancing. You may be good at creative writing. Spend at least a couple of hours every day to explore the creative streak in you. That will help you grow as a person. Cut routine work with time. Maybe you're working for 12 hours a day at the beginning of your career. Maybe after 10 years, cut it down to maybe 8 hours. Maybe after 60 years also, doctors love to work because, as they say, doctors are incompetent in even fixing a bulb at the home because that is the level of efficiency doctors have related to things outside the profession. Of course, you don't have anything else to do, but work for 4 hours a day and leave the rest for hobbies and other things. And you should have a very strong support system. Why I'm saying this is, when you are at the peak of your practice, you're invited to many public functions, marriages and other social occasions. But due to your work pressure, you're unable to go. And people will say that even the minister had time to come for this marriage function. Why is this petty doctor don't having any time to attend this? And this is a big problem because you get socially isolated from your near and dear ones. You're unable to attend the marriage of your relatives, your friends, your acquaintances, the people at your native place. And finally, after you become retired and it is time to invite them for your child's marriage, they may not be having a positive regard for you. And that is where you come to know that you have got isolated. Exercise is very important. At least 45 minutes of exercise with exposure to sunlight will increase your dopamine, leading to improved concentration. It will increase endorphins, giving you a sense of well-being. It will increase the blood flow to the brain, making you more energetic. And if it is with exposure to sunlight, it will give enough vitamin D, improving your information processing and immunity also. Time management is another area where doctors falter. So time is the most precious commodity available, is the most important resource available, but it is not storable. Utilizing time appropriately, going for vacations, spending time with children, spending quality time with family members, going and watching a movie, listening to music, all these things you should find time even at the peak of your practice. Do you want to be effective or efficient? That is the next question. Effectiveness is doing things correctly, while efficiency is doing the right things correctly. So that is what you have to develop. So how to deliver concrete stuff in the limited time available, whether it is a talk, whether it is communication to a patient, whether it is the art of breaking bad news, anything. So in time management, the following tips can be kept in mind. Manage crisis situations. If your child is ill, that gets the top priority. Drop everything else and spend time for that. Of course, if there is an emergency exam which is coming up, you need to prepare for that. Anything which requires a deadline, you have to devote and dedicate more time for that. And other pressing matters and projects in which you have invested, you need to spend sufficient time for that. Focus on preparing, planning, preventing crisis, value clarification, and equal time has to be spent for building relationship, recreation, and exercising. Because the Harvard Human Development Study has very clearly shown that the most important fact which enhances the lifespan of a human being is the quality of human relationships he develops during his childhood and youth. It enhances your life much more than cutting alcohol, staying away from tobacco, exercising, and having a proper diet. That is very important. Interpersonal relationship takes precedence. Avoid interruptions. Avoid phone calls which are not pressing and compelling. Avoid charting out and scheduling too many meetings per day so that you get stressed in the process. And you may have a tendency to become popular. You want to present yourself in the media or other public platforms. Of course you can do, but don't hard press it in such a way that you are seeing 150 patients per day and doing all these other activities along with it. So avoid time wasters, spending a lot of time on mobile, social media chatting, which are inconsequential in any way to your life. Avoid such things as much as possible. Marriage is a very important thing in your life. A workaholic, perfectionist, compulsive husband may not have time for the spouse. Same is true for the wife also. So these are the three things you need to control once you plan to get married. You plan to get married, of course, workaholism is good. You need to become efficient at your work. No need to become a perfectionist. Only basic things need to be satisfied. You learn the art of delivering good stuff in small quantity of time as you grow up. Don't be compulsive. So you have to spend time for your spouse, because if you don't spend time for your spouse, chance for infidelity in relationships are very common, especially in the life of doctors. Boredom in a marriage is going to breed a whole lot of experimental behavior which can lead to issues in marriage. Poor financial planning, another very important Achilles heel of doctors. You have to learn the art of finance management and avoid risky investments. And career crisis can happen, because as they say, among doctors there are two syndromes which are very commonly seen. The Perindachan syndrome. When a young doctor is growing and developing and becoming popular in your profession, you may feel like bad-mouthing him so that he doesn't take your space. Avoid that. Another one is Phosphorus syndrome. You may get a lot of help from a senior doctor in establishing yourself, but once you establish, you badmouth your mentor, saying that he has not helped me in any way. I helped him. I taught him so many things. These two things are very common. It is not healthy to do either of these. So spend time with your spouse, respect your spouse, have fun together, treat your spouse as the VIP of your life. That is only VIP you have in your life. And a loud spouse is invariably a loving spouse. So the art of expressing affection to your spouse, that is something which we need to put into practice. Parenting, that is another area, because nowadays people say that the children of doctors are becoming extremely wayward. They are spoiled bad. So at least spend one meal together in a day, half an hour of quality time every day, going out at least once in a week, going for a vacation for 3 days at least once in a year. Children should get a chance to meet the grandparents and build relationships, and kids should understand to honor family traditions. The last 2 slides, I'll finish in 3 minutes flat. What should you do after your retirement? Is a big question. Should you stay with children? Avoid that as much as possible, especially if you stay with your in-laws. it is going to be a big problem, because you will have this tendency to boast them and they won't be appreciating that very much. So find a special space for your own. You can visit your children once in a while, but don't intrude into their life and try to control their life. Treat them as adults and plan to manage health problems. Every doctor should take a health insurance policy and build a support system so that somebody will be there to take care of you when you are really ill. The last slide, the 10 commandments. You should not expect somebody else to manage your stress. Managing your stress is your responsibility. You should not resist change. Technology, AI, new therapeutic methods will be coming. Youngsters may take over. That is natural. Accept it, appreciate it, mentor them. And you should not consider yourself in vain. You should have a purpose in your life and give priority to things which are important, holy to you. Understand your limitations. Medical practice is a teamwork. You are not a superhuman doing everything at the same time. You should not work alone. You should ask for second opinions or opinions from other specialists if you want to work. You should not kill a person. You should not kill yourself. Never commit suicide. Go for a support system help if any such tendency is happening. You should not work harder, but you should learn to work smarter. There is no point in working 18 hours a day. Work for 8 hours a day, but put in efficient work. That is smart work. Find joy and mastery in your work. Explore more. Find more expertise. Get trained more. Do better things and bigger things in your own profession. Be recognized and respected as a master in your profession. And finally, you should be a lifelong learner, because as they say, medical profession is a lifelong learning process. My sincere gratitude to Devin sir and the entire organizing team for this great opportunity. Thank you very much.